Okay guys, so today I want to talk to you about something that we see all the time and happens to basically everybody if you live long enough. Okay, and that's just osteoarthritis. We see that most commonly of the hip and the knee, but it can happen everywhere. Today I specifically want to talk about osteoarthritis of the hip. Okay, so the way that this happens is really just a gradual occurrence of wear and tear on the joints. It's kind of a combination of mechanical forces on the hip, so just the pounding that we put on our hip throughout our lives, and then also any inflammatory processes that have happened over time, any injuries that have happened over time tend to make osteoarthritis worse in the long run. Okay, so I want to talk to you a little bit about the anatomy of the hip and what's actually going on when you have arthritis. So you can kind of see in this model, the hip is where the leg, so this is kind of a right hip, it's where the leg meets the pelvis. Okay, and the hip is surrounded by a ton of musculature, but if you kind of break it down, you can see through here it's called the capsule. Okay, it's every joint is surrounded by this capsule, and it just is a bunch of ligaments that surround the joint and kind of keep it stable. On the inside of those ligaments is what's called the synovium, and it's basically what produces synovial fluid, and that's a lubricant and kind of the nutrient-rich fluid that helps keep the joint healthy. And that's important because that actually on the inside of the hip you have cartilage. Okay, there's cartilage on the end of the bone, the hip bone, and then there's cartilage on the inside of the pelvis. Okay, and that is what breaks down with osteoarthritis. Okay, the cartilage starts to break down and it starts to degenerate, and that's when you start to get kind of that grinding or the clicking or popping that can happen with arthritis. Okay, so let's talk about the signs and symptoms, what you're going to feel. Okay. Arthritis is typically not something that happens due to an injury right away, but it tends to be a gradual onset of this aching pain that you feel deep in the hip. Okay? It'll be aching pain, you might get some grinding, you might get some clicking or popping, things like that. And you may even find that you get some radiating pain that comes down into the leg or wraps into the groin a little bit. Okay? And that tends to be worse when you're standing on it for long periods of time or have been walking for extended periods of time, things like that. Okay? So let's talk about treatment. What do we do for that? A saying that is as old as time with physical therapists and is kind of cheesy, but it actually is true, is motion is lotion. And let's come back to what we talked about earlier, which is the synovium. Okay? The reason that motion is lotion is because the more that hip joint moves, that stimulates the synovium to produce more of the synovial fluid, which is again that lubricant for the joint and helps keep that joint healthy. So the best thing that we can do for you when you have when you have hip arthritis is to really get you moving in a way that is not painful. Okay? So that's why you come to a physical therapist, because we can help address your specific problems. We can find where your weaknesses lie, and we can create a plan that's going to help you to be mobile without having quite as much pain. Okay? So keep in mind that physical therapy does not get rid of arthritis. Physical therapy does not heal arthritis. The only way to get rid of the arthritis is through a total hip replacement. Okay? And that does happen sometimes. And physical therapy before a surgery like that just makes the surgery and the recovery better. But keep in mind that physical therapy can be very helpful in pushing off a surgery for a little while and keep you mobile and keep you active as long as you can.